We all have the same condition. It's called life. For me, it means being a gay man and an addict in recovery, and sometimes a drag queen, and dealing with aging and sex, and being a friend, and finding happiness, and doing it all while living with HIV for the last 25 years. This much I've learned. Life definitely has side effects. I'm Mark S. King, and this is my fabulous disease. This is me about a year ago, with mild facial wasting from HIV-related lipoatrophy, and with the feeling I was beginning to wear my HIV on my face. This is what I look like after 3 treatments for the wasting. The product I used isn't permanent, and the injections are uncomfortable. I just want to say to all my friends out there at thebody.com, all you viewers of my blog, what I won't do for my blog. This is for you. Shut up, drama queen. Anyway, since there was a lot of interest in the topic, I'm taking you along on my 3rd appointment. This time, I'm going to let my physician, Dr. Gerald Perrone, explain things from his perspective as I begin my 3rd treatment.
Hi, this is Dr. Jerry Perrone in Vero Beach, Florida, and I'm here today with Mark King for a treatment of Radius and Sculptra. I originally treated Mark for HIV facial lipoatrophy about 10 months ago. He then had a follow-up treatment 8 months ago, and Mark had a good result. He has noted some drop-off in the correction over the last few months. What I want to accomplish today is to really try to bring him back to full correction again. During today's treatment, I'll go through some of the more technical considerations of the treatment, the molding, how we use Radius first and then use Sculptra on top of it, and hopefully he'll continue to have positive results.
And it didn't seem exaggerated until it started to settle down, you know, and by that I mean a month. You know, a month or so went by, and then it started to really kind of just like settle. But during that month, I didn't feel like I looked unnatural. It just wasn't quite me, you know, and now I feel like I've gotten my face back.
You definitely look better than when I first met you. You still have some mid-face lipoatrophy. One of the nice things about doing these treatments is with the follow-up iterations, when you're retreating, you can blend in the edges of these contour irregularities. So you may still treat in this area, but you would just treat below it as well in this area to give it a smoother appearance. The areas I see, the triangles from lipoatrophy, some scarring down here, a little bit of volume loss, and in this ridge, softening that ridge and making the contour more irregular. And then if we have this ridge and deep breath. Usually the first injection is the touchiest. Seems like more of your atrophy is on the right, a little bit more. So I'll actually use a little more product on the right compared to the left.
Sometimes when I am massaging, you know, 5 minutes a day, 5 times a day, I'm wondering if I'm massaging too tough. Is it possible that I can displace the Radius the second day, or should I not be worried about that?
Shouldn't be worried, but I wouldn't massage overly aggressively either. You know, the right pressure is with your thumb about what I'm doing right now.
Okay.
Kind of moderate pressure.
Okay.
Technique that I'm using is called a tunneling technique. And really through that same puncture site, I'm able to fill this entire right cheek area. Good. Radius has a durability 9 months, 12 months plus or minus, and Sculptra 2 to 3 years it looks like. Immediately after it's done, Radius can often appear lumpy, bumpy. And I think last time you had that too. Like if you look over here, you see here's the implant, and the edges are, it's kind of, the contour is not completely flat. And a lot of that is it's a tissue reaction to the filler. That fades in a day or two. We made it halfway through the treatment. We've done the first part, which is Radius, and we've really targeted these mid areas and on the right side down here, partly because of some scarring. And now I'm going to use Sculptra. What I'm going to plan to do with Sculptra is treat these same areas. The idea being that overlaying Sculptra on top of Radius, as Radius goes away, Sculptra will be working in here, which is really your main area of concern. And if we have enough, well, just a little bit of jawline enhancement. This way you can see if you like that and go from there. Okay, so really what we've achieved here is increased fullness in this area, overdone, well, clearly, and you can see this kind of band up here, and what that band represents is Sculptra on top of, beneath, and above that little bit of nodularity that was here. After treatment, this is not a normal appearance. You're kind of puffy, you almost look like a Star Wars creation for 24 hours, so this acute swelling goes down pretty quickly. But in general, you can see what we did. This area that was depressed before is now up a little bit here, just to treat these areas. And in the beginning, we're trying to bring a sharper jawline by giving some volume over here. Okay.
Hey, I like the look of that jawline.
Okay, very good.
Okay.
Okay, thanks, Mark.
Well, it's about 13 weeks later after the follow-up appointment, and this is how my face is looking. I want you to be able to get a good look all the way around. I'm very happy. I'm very happy with the results. I think it probably looks like my face would have looked had I not had the facial wasting. So I'm happy with it. Now, I want to make one thing really clear, and that is that I realize how fortunate I am. I know that there are a lot of people for whom paying for such a treatment is just not possible. As always with my blog, I'm just sharing my experiences about this. However, there are patients' assistance programs where you can get the cost of products like Radius and Sculptra at a reduced rate, if that's helpful for you, although you'd still have to pay for the doctor to do the injections. So the best thing always is to talk to your doctor, or talk to a doctor that does this procedure, and it never hurts to ask, to find out if there's some sort of reduced rate that he might offer as well. Thanks as always for watching my blog, and in the meantime, please be well.